we're going to ask that everybody use the chat box so we're all on the same page, as they say. So any comments, quibbles, I can't hear you, that kind of thing, plus any questions, please put it in the chat box. And make sure that you send it to all attendees and panelists, not just panelists, because then we'll be the only people that see it. So there's a little drop down, panelists and attendees.
And I want to thank Anna Bowers, who was the first one to make a chat comment. She said happy birthday. And I remember Anna. Anna was at one of our seminars. I think we were speaking in Philly years ago, and she was like a great participant. She's been following us since. So Anna, thanks so much for saying that. I appreciate it. While we're looking at the chat box, if everybody, wow, we got a lot of people that have come on already, and it's growing. Hundreds. If everybody would say in the chat box where you are from or where you are right now, we would love to see where you're hanging while you're watching this webinar. Indiana wants me.
Glenwood Springs, Colorado. Sounds
Where's
beautiful.
Owasso, Michigan? Michigan.
Make sure you do it to panelists and attendees, not just panelists. Joyce,
right, we want to see everybody.
Pittsburgh, Edmonton, Alberta, Cleveland,
Richmond,
home of the Rock and Roll.
Virginia.
Got my hometown of Baltimore, Maryland in there. Someone from
Denver, Colorado. What are you doing right now?
Farmington Hills.
Timonium, Maryland.
They're going so fast.
I know.
I know they go fast. They're going really fast.
Rouge. A lot of Detroit people today. Linwood, Washington. Wow.
Betty, you're bringing a lot of people from the Michigan area. Los Angeles.
New Hampshire. Oh, I love Lake Winnipesaukee. Tracy, I hope you're somewhere near there.
Haskell, New Jersey.
The Ravens are going to be tough on the Steelers.
Another Michigan. Doa Geek. I don't know where that. I probably totally botched that pronunciation.
You got New Rochelle, the epicenter.
Lots of Vermont, my home state.
Fargo, North Dakota, Canada.
A bunch of Canadians. Toronto. Wow.
Houston.
Between Boston and New York. Very nice. Santa Rosa.
Idaho.
Wow. So Arnold Weiss
we know those
let's
folks.
Get started.
He said, let's get started. Well, you know something? We do these things at our pace. At our pace.
What state is that? Let's get started. I'm not familiar with that.
Oh, Seattle. That's where I am.
That's right near you.
Enid, Oklahoma. Who's from Enid, Oklahoma? That was cool.
Wait a minute. How about who was that guy? The chameleon. What's his name again?
Lieutenant Lizard.
Oh, Lieutenant Lizard. That's right. Lieutenant Lizard
Oklahoma.
on the radio in the 80s.
Dallas, of course. Tracy Wen is from Discovery Bay. All right, that was really fun.
I love it. Love it.
Yep. A lot of inside jokes in here too, I've noticed. Not sure why. Before we bring in our guest speakers, and they are just fantastic. We want to talk a little bit about, if you read some of the marketing materials, our friends at Care Credit. I don't even know what that last one means. Oh, that's funny. Our friends at Care Credit were kind enough to sponsor this seminar and help us with it because, as you know, we don't charge for these seminars, and they do cost us, and we do them anyway. But it's really great when we get a sponsor. We appreciate it so much. And the folks at Care Credit have done so much for dentistry over the decades that we've been involved with in helping patients afford their treatment. And we were talking to our friends at Care Credit just a few days ago, and they said, you know what? We've got a really, really important announcement, and we would like you guys to kind of break it on your webinar to be some of the first people to talk about something that Care Credit's doing. So, Sylvia, if you could put up the first Care Credit slide, please. And Sylvia is working behind the scenes frantically to make this thing run smoothly. So she's so kind to do it. Now we get to see her entire computer, all her little icons there. They're too small to read. But I know she's got
desktop, Sylvia. Way too much.
Should we be worried?
She's got what?
Some Excel spreadsheets up there.
Oh.
Her desktop is it's too much, way too much stuff up there.
Yep. So Sylvia, you can put up the first Care Credit slide. One of the reasons we wanted to talk about this is because obviously we're in really, really crazy times now, something that we've never experienced before. And we fully expect that when you reopen, and obviously it's different in every part of the country, and even in some part, in the same part of the country, depending on your personal judgment and feeling about the right time to reopen. I think one thing that's for sure is patients have been sitting around for the last month or two nursing these minor dental emergencies, thinking, I want to get in for a cleaning, all those things. And in the meantime, some of them will have been, unfortunately, under financial stress. So we're going to have the combination of people that want to come in, maybe for some, pretty decent amount of dental care, also under financial stress. And Care Credit knows that, and they were thinking, how can we respond to this great need that people have? So Sylvie, if we could go to the next slide, please. As you know, if you've seen me or Dave, I think you skipped one, actually. If you've seen us lecture, so let's go back one. You know that our favorite thing is to offer Care Credit for 12 months, because then the amount that you pay Care Credit is so small that we can tell our patients we're giving them 12 months interest-free, and that is fantastic. Now, as you know, with Care Credit, patients have other options, but if they do an 18-month or a 24-month, they're going to be paying a much higher interest rate. And there's no way in the world that we would recommend absorbing that interest rate into our fee and just eating it, as they say. And that's one of the reasons we love the 12 months interest-free, so we can absorb the interest rate and present that for our patients. But Sylvia, if you can now go to the next slide, Care Credit has determined that to help out all their practices, they're going to offer the same deal for 18 months. Now, I don't like to mention percentages because I always get it wrong, but I believe it's around 9.9% that we're taking back from Care Credit to offer our patients 12 months interest-free. They're going to do the exact same deal for 18 months. So if you were offering your patients 12 months interest-free at the same cost to you, you can now offer your patients 18 months interest-free. It looks so much more attractive. And as you'll see when you're calculating the amount the patient pays per month, it's just a much, much more reasonable and easier to handle for them amount. So great news from Care Credit. 18 months for your patient, the same deals we were doing for 12 months before. So keep the slides going, because I'm sure you know their website, carecredit.com, but talk to your Care Credit rep. They'll tell you all the details to get you all set up. And your Care Credit reps are fantastic resources. They can talk to you about many other things, not just financing, about things that are going on with your particular area, what things in your area, what practices are doing to utilize third-party financing more, get more treatment plan acceptance. They're great sources of information. So talk to your rep, not just about this, but about other issues you're having in your practice. So we just want to thank Care Credit once again. They've been great friends and supporters of the Maddow Center. They've been great friends and supporters of individual dental practices. And we just want to let you know, as of right now, the promo is for May, June, and July. So you'll have plenty of time to take care of that with your patients. And it's, again, as we say, it's going to be weird when we open back up as we work our way up to being full steam. And any help we can get to let our patients afford their treatment is fantastic help. So once again, thanks to our friends at Care Credit for allowing the American population to afford better dental care, and for helping us with our webinar. Excellent. All right, so we can go back to our beautiful faces on here. Well, maybe not me and Dave, but the other two beautiful faces.
Rich, before you introduce our fantastic coaches, I'm going to say something real quick, then we'll get right into today's program. We're going to have a lot of really good information today, so make sure all of you out there in webinar land, as Rich says. Rich, you didn't do the whole arena stadium thing.
Yeah, well, go ahead.
Okay. No, that's I don't have to do. But if you're out there in webinar land, we love you. We appreciate you being here. Make sure you have plenty of paper, and I always like to say 2 sharp pencils to take notes. There's going to be a lot of really good notes, and I know that nobody really takes notes with pencil and paper, but still, you know what I mean. Make sure you're able to take notes in some way. Now, in case we go fast and you miss something and you don't get to ask your question, this will be available. The video of this will be available almost immediately, well, as long as it takes for Sylvia to get it posted on our YouTube channel, which is the Dental Practice Fixer. So if you just go to YouTube and do a search for the Dental Practice Fixers, that will come up. You'll get to see our video there, as well as on our Facebook page, the Maddow Center for Dental Practice Success. Both of those will have our video. Now, in mentioning that, I want to say something. In case for some reason you missed our webinar from 2 weeks ago, I'm going to highly suggest you go back either on our YouTube page, the Dental Practice Fixers, or Facebook, the Maddow Center. Look for the video called "What Are the Top Dental Practices? What the Top Dental Practices Are Doing." What the top dental practices are doing. It went for about an hour, so give yourself that much time. There's an incredible amount of information there. You're going to love it if you didn't see it, and if you saw it, go back and check it out again. And something I want to mention that we did on that video, I'm going to just say it. Rich and I did a little, I'm going to go quote unquote, we did a little ad for something, which turned out to be so cool. And dentists are using this little idea we had right now to actually bring immediately income into your practice. It's simple. Every single dentist watching this can do it. You'll see what it is, but go back and watch that video. You are going to love it. So make sure you check that out. And I think that's kind of the announcements I had to say. But Rich, I'll turn it right back over to you.
And I'm just going to be really fast, because if we took the time to credentialize our coaches, we would be another 20 minutes. I know people want us to get down to the reason you're here to learn more about in-house membership plans, which we love, and we love teaching about them. And they're going to be more important than ever, again, in this post-COVID-19 world. So we've got Coach Betty Hayden and Coach Kara Jones with her, two of our fantastic coaches. They have helped practices across the country for many, many, many years. They've helped them succeed, bring in more income, enjoy dentistry more. That goes for dentists and team members, just get their systems in place. And they've been incredible developing custom plans for the dental practices with which they work. So that's all I'm going to say about them, except that they are two amazing people that we love working with day in and day out. They're smart, they're fun, they're just amazing. So with that said, Kara Jones and Betty Hayden, please take it away.
Perfect. All right. Hey, Sylvia, will you pull up our PowerPoint as well? So Betty and I have several offices that are currently already using membership plans very successfully. And I think one of the main things that we see a lot with offices is the setup and training aspect of how to actually make it hit the ground running. And Betty is going to start and talk about why you need to have a dental membership plan and the 8 reasons that your practice needs it more than ever. So I'm going to pass this along to Betty, and then I will talk with all of you about the setup and processes once we have gone through these top 8 reasons.
Thank you, Kara. So why have a membership plan? That's a great question to ask ourselves, or maybe some of you that are listening today already have a membership plan in place, and maybe you're just looking to fine tune it a little bit, or maybe some of you have been wanting to implement one and don't know where to start, or you don't think it's necessary. Maybe you just don't really see the benefits and why we need to have a membership plan in place. So we're going to go through some reasons why a membership plan in your office, a savings plan, is a really great idea. And so many offices that we coach and work with have membership plans in place that are working really well. And some have some that are not working well. Why is that? Why are they not working? So as we go through these reasons today, it's going to help you to see, okay, if you have one and it's not working, why? What can we do to change and improve it? Or if we don't have one, what can we do to implement one? So one of the #1 reasons why we would want to have a membership plan, a savings plan for our patients, is because we want patient loyalty. Loyal patients, isn't that what we all want? Loyal patients that return year after year, that accept your treatment recommendations, and they refer their friends, family, neighbors, and coworkers. Now more than ever, we need to have a membership plan in place, because we have some patients that will be returning to their job, and maybe they have lost their insurance. Maybe they're not returning to their jobs and they've lost their insurance, they've lost coverage. We don't really know what the situation is going to be like for a lot of our patients, and them feeling like, what are their choices right now? Where are they going to go? If they've lost their insurance, maybe you have patients that never really thought about their finances before, and now that is a factor that is going to play a role in them choosing a dental practice. Or you also have patients, sorry, my laptop battery's just about to die because it's not plugged in. So we will get that plugged in right now. And So you have patients that they need a reason to stay. It used to be okay just to provide them excellent dentistry. That was good enough, right? Well, now we know that more is needed. So having these membership plans in place helps to create loyal patients, patients that stay and that accept comprehensive dental care from your office, right? But along with that, one of the second reasons why we would want to have a membership plan in place is to ease that financial burden that some of our patients may have. So we know the quickest way to lose a patient is for them to think that they're being taken advantage of. So we need to clearly explain the cost to do treatment and the cost of doing nothing. And because we don't like surprises, we tell our patients just that. We don't like surprises, so we're going to estimate as closely as possible what your financial portion is for treatment. But many patients, many people, maybe that don't even have a dental home, the reason they don't have a dental home is because they think dentistry is too expensive, right? And you know what? I believe that it is expensive, and everyone defines expensive differently, but we know that neglect is far more expensive. So if a patient thinks that it's okay to go ahead and skip this routine hygiene appointment because it's just a cleaning and it's not important and it's not going to affect their oral health, they put off that care, right? Well, we also know that a full hygiene schedule today is a full doctor schedule tomorrow. So having a membership plan in place makes it so much easier and less expensive for a patient to keep up with their preventive care. So then you're able to, because they're there for their hygiene appointment, you're able to diagnose problems before they worsen, right? Before it becomes more expensive to the patient. And so having just that part of it, to know that financially we're making it easier for our patients to say yes or no to our care, will make it easier on them moving forward with our treatment recommendations. So easing that financial burden is really important. Another reason is it allows you to increase your profits in your practice ethically. So let me ask you this. How many of you just love sitting on hold with an insurance company trying to collect on unpaid claims? Or how many of you have heard a patient say, is that going to be covered by my insurance? Or I'll only do that if my insurance pays for it. Well, with a membership plan and plans that have a yearly fee that cover a patient over a 12-month period, the cool thing about it is there's no billing, there's no waiting periods, there's no wondering exactly what the insurance company is going to pay. You know, there's so many times where we've estimated to a patient what their insurance may or may not cover, and then we are surprised to find that it's not covered or they've reduced the payment, right? Which aggravates the patient. Well, that's not going to be the case with a membership plan, with a savings plan. And while it is not insurance, and we don't want to refer to it that way, it does take that question out of the patient's mind. So their treatment acceptance isn't based on whether or not their insurance may or may not cover it. They know exactly what their expectations are. And so your collections increase because you're not having to spend all this time trying to chase insurance money or all this time trying to explain to the patient why they may want to go ahead with the treatment even though their insurance may or may not help them with it, right? So right away, just with that, you are able to help more patients say yes to your treatment recommendations because that insurance question is taken out, right? They know exactly what their expectations are. And the best part of that is when your patients are healthy, your practice is healthy. So in order to have healthy patients, that means having better patient compliance, which is number 4. Better patient compliance. Wow. Having all of your patients go ahead and say yes to your treatment recommendations is wonderful, but there has to be value there. They have to see the value in saying yes. How is value created? Value's created when the benefits outweigh the cost. So you want to focus on the benefits. Well, in addition to a membership plan helping your patients say yes to treatment and to be more regular with their preventive appointments, having the membership plan also gives them exclusive member pricing. You have patients that know they're getting more, right, by being a part of your membership plan and your savings plan. And so they're going to continue being loyal to your practice, but in turn, they're going to appreciate that value that they're receiving. And people love to share when they're getting a good deal, right? It's something that we like to talk about. So guess what? They're also going to talk about you to their friends, to their family, to their neighbors, to their coworkers, because they see the value and the plan that you're offering. And that goes right in harmony with the value of the care that you're providing. So with some offices, and when they put their savings plan, their membership plan in place, they offer incentives along with it. And those incentives may be whitening for life. It might be a Sonicare or electric toothbrush or a water pick. Something is added to that membership plan, something that makes them feel like it's special, and it will also improve their oral health or improve the appearance of their teeth. So, you know, when we think about presenting treatment to patients, we all want our patients to accept treatment, but we know that that doesn't always happen. And for some offices, it's a struggle. So just having that better patient compliance is a fantastic reason to have a membership plan in place. The next reason is, how do we build this? What does this look like? Well, whether you have a plan in place or not, or whether you're looking to build it, think about this, okay? Some of you might be thinking, this is too much, this is too difficult, I don't have time. Well, keep it simple, right? So there are so many offices out there that are offering membership plans and savings plans to their patients. There's a wide variety of options out there, but the most effective ones are the ones that are simple. So you certainly could have a plan where you have a single person or a family plan, one for children, one that is a perio plan. But the more options that you attach to your plan makes it more difficult for people to say yes, right? They get overwhelmed by the different options. So keep it simple. Build a plan that makes sense for your office. So if there's things that you want to exclude or things that you want to be able to add to the plan, you're going to work that in to what you offer the plan pricing for. Your patients need to be able to see what the savings are for them, what's in it for them, but it also has to make sense financially for you and your office as well. So this is, you know, number 5 in the reasons, but I would say this is like a really critical reason and step to creating your savings plan is to keep it simple. Don't overthink it, but make sure that it makes sense for your practice, okay? And the reason that we build these simple plans, membership plans, is because of number 6. We are in a membership-driven society, okay? You have memberships to companies like Costco, Amazon, and gyms, and they offer member-exclusive savings and perks, right? So, gosh, think about Amazon for a minute, and this isn't a plug for Amazon, but I'm telling you, I buy more from Amazon because of the free shipping, and it's so convenient, right? So those benefits, the perks of being a member. Now, my gym membership looks a little bit different, and I'm not going to even take advantage of that one. But anyway, we can see how important these membership plans are and how people are attracted to it. They like to feel special, and they like to know that they're saving. And the cool thing about that is if patients feel that they're getting more, they're willing to pay more, and they're willing to buy more. So having a membership plan allows more of your patients to say yes to their very best care. And you know, if it's not a membership plan, it's a rewards program. We have rewards programs at the grocery store, at gas stations, at drug stores. That's the norm nowadays. People are looking to see what kind of savings they can have, but also what's in it for them again, and what do they get from it. So when you have this membership plan in place, your patients are more inclined to accept your treatment, but they're also understanding the value of what's in it for them, why it's going to make sense, not just to their wallet, but for their overall health. So it's really important to have these membership plans in place if you want to increase your case acceptance. And we want to increase that because we want to help more people smile healthy. One of the other amazing reasons to have a membership plan is you get to take control. So have you ever had a patient call you up and say, do you take my insurance? Or have you ever had a patient call up and say they needed to switch their records over to their new dentist because of their insurance plan? It is so frustrating when we're dealing with that insurance question and patients saying they can only go to a dentist because of their insurance. But it's not just about the frustrations that we feel as an office. It's a frustration to your patients as well, right? They feel like they have to go to a particular dentist because that's on their plan, right? So they're paying these high premiums for insurance, and then they're being told where they can go to have their dental care and dental needs taken care of, right? So that can be very frustrating. So when you have that membership plan in place, it allows you to take on more control, right? So you're able to offer for your patients to not have those same type of restrictions, to be able to have more choice in who they see and the type of care that they're accepting, and it not be based on insurance. Insurance is wonderful for our patients that have it and that it assists them. That's great. But for many people, it doesn't make sense. And for others, they don't have dental insurance, right? So having this control, again, by being able to offer a membership plan, savings to your patients, makes more sense. But then you might be thinking, okay, well, we have this control, we have this membership plan in place, but guess what? I don't want to sell it. I don't want to sell membership plans to our patients. I'm not a salesperson. But I want you to think about it this way. Selling is a transfer of enthusiasm. So if you're enthusiastic about the great savings plan that you offer, if you're focusing on the benefits of your savings plan, then it's easy to talk about it, right? You want to share that with people because you yourself see the value. You see the savings that it can bring to your patients. And more importantly, you know that by your patients accepting and signing up for your savings plan, that you have the opportunity and the privilege to help people smile healthier, right? How much more reason do you need to share that with others than that? So talking to people about that on the phone, you know, if they call and want to know how much something cost, right? So you get those dreaded shopper callers. Oh my gosh, right? People don't like shopper callers, but shopper callers are amazing. They're amazing because guess what? They're ready to buy. So it's an opportunity for you to be able to help them. So maybe their question might be specifically about price, but now we have an opportunity to get to know them first. Sounds like, you know, you're looking for a new dentist. You know, I assure them that I can help you with that, and letting them know the savings plan that you have in place in your office, because we understand that many people have lost their insurance, that are under some financial burdens right now. And so to make that easier on people, we have put in place an amazing savings plan to help people be able to get the dental care that they need. You know, just talking to your patients and your callers in that way and letting them know that we're here to help. And in order to help you smile healthier, this is what we've put in place for you. So really understanding everything that is involved in that savings plan and that membership plan will really help you be able to talk about it to your patients and to your potential new patients with enthusiasm. And that's what we want. So we talked about ways that we can help keep our patients loyal to our practice. Let's talk about attracting new patients. So membership plans allow you to attract new patients. So right now, there's a huge opportunity for you, because many people that may have been restricted to see a particular provider because of their insurance may have unfortunately lost that insurance. And so they might be looking for a new dental home. So having this membership plan in place now makes a lot of sense, and it's going to help you attract new patients. And it's amazing and awesome because marketing for your membership plan is free. It doesn't cost you anything to do that. So talk about your membership plan to your patients that are in office. Talk about it to your patients that are on the phone. But to attract more new patients, you want to make sure that your membership plan is on your website, that it's on your social media platforms. So it's on Facebook, it's on Instagram, it's on your Google business, My Business listing. Put it everywhere that potential patients may see it, and it's going to sell itself. People are looking for new dentists. They're looking to find somebody that is going to give them not only amazing dental care, but it's also going to help them save money, right? And again, going back to what I said earlier, when your patients are healthy, your practice is healthy. So that really is a win-win for everyone in helping to draw new patients to your practice and then keep them loyal to your practice. So for some offices that don't have a membership plan in place, I shared 8 reasons with you. And you might be thinking, okay, that sounds great. I like that. But you know what? It's a little crazy right now in our office, and we're just working on trying to reopen the doors and to stay safe. I don't think this is something that I can implement right now. It sounds like it's too much work. What does that even look like? Well, we promised you 10 reasons why you need a membership plan. So we're not done yet. And Kara is going to show you even more reasons why you should put a membership plan in place. Kara is going to help you put all of these pieces that we talked about just now together. And she's going to show you how you can set up your own membership plan, how you can implement the membership plan in your practice, and how you can ensure that your team is effectively trained on how to use it. And that part's really important because we often hear the membership plan doesn't work in our office. It doesn't work for us. And what we have found is that usually comes back to training. the team is not trained properly and effectively in how to offer it effectively and with enthusiasm. So that part is really important. And she's also going to tell you more ways that you can market your membership plan. So with that being said, I'm going to turn it back over to the lovely Kara.
Thank you. All right, Sylvia, we'll go to the next slide. Okay, so we just reviewed the 8 reasons why you need to have a dental membership plan now. If you have one currently, we're going to talk a little bit about that as well. But as far as the top reasons, we discussed patient loyalty, ease of financial burden, practice profit ethically, better patient compliance, building a simple membership plan, the membership-driven society we live in, making a shift by taking better control, and then attracting new patients. One question that has kind of come up a few times to us as panelists just recent was, is this something that we can bill in conjunction and add with patients with insurance? We don't recommend coordinating any kind of coordination of benefit with this plan. So this is for those patients who do not have insurance, have a loss of insurance, maybe there's a break in that. People retiring, that's another great way to get patients to continue to be committed and not have to go to the insurance market, overpay, get stuck with these crazy high fees per year they have to pay with zero return for their money because they have waiting periods, they have small yearly allowables, and the list goes on and on. What I'm going to now talk about is how do we now implement this? How do we get it started? So on the next slide, the main piece here is putting it together. So the key to this is your team. Whether you're a doctor watching this today or whether you are a team member, it takes the entire team to make this happen. And it does require some planning. It's not just about buying something, then putting it into your practice and saying, okay, let's do it. So everybody, let everybody know we're going to do this. There are going to be tons of questions, just like you're asking us now, that your patients are going to be asking. So if your team and you have not come up with or discussed what these FAQs could potentially be, everybody's going to be hesitant about talking about the plan, selling the plan. So we're going to talk today to help you guys be a little bit more successful when we have to implement, okay? The next slide is basically putting the pieces together. So the red puzzle piece here represents the team, okay, each of you. And again, that's the driving force to making all of these puzzle pieces fit around and work together. So one of the number one things that I know I see, and I'm sure Betty would agree, is we can come into a practice and see that there is a membership plan in place, whether you've bought it from another third-party company, whether you have a third-party company managing it for you. Some of them have platforms, some of them send you, information to log in and manage it that way. But really, the management side of it, you don't need anything fancy like that. You have the ability to set this up in your practice and do it well and it be successful without giving a profit of this membership to another company, okay? We do offer our own membership in a box with simple how-tos, step-by-step, which a lot of what you're going to see today is in our actual product. And we don't take a profit from it. This is just to help your team successfully implement and feel confident in getting patients to say yes and helping them to feel better about choosing you and to get better patient compliance. All right, so what we're going to talk about as far as the membership setup. When setting the membership up, there's several factors. So the first factor that we're going to discuss is fees. So the number one question is, how do we determine what to charge? So you as a team are going to assign certain tasks to each of your team members, and part of this is research. Reaching out, Googling within a 5-mile radius from your practice, other dental practices that may have a dental membership plan. What are they offering? How are they advertising? The second step is going to be to then call some of those offices and do your own shopping call. Pretend you're a patient without insurance, you saw this online, find out what they offer and how they schedule. You need to know what your competitors are doing, so that you then know how you're going to set yourself apart. And it may not be that you're beating them price-wise, but you know what's out there and you know how to create a better product, okay? Okay, so before setting the fees, we have to determine what our costs look like. What I usually do is I have my offices do a little exercise, and it's pretty easy. It's, you know, what is your average, what's your fee for service on a pro fee? How many x-rays are you usually taking on a patient once a year? So if that's, you know, 7 vertical bite wings, if that's 4 bite wings, typically, whatever your number is, that has to be added. If you're doing that once a year, twice a year, whatever it is. Your exam cost, and then if you're offering fluoride, which I would add that as a member benefit, and you're going to add up these services, okay? The average patient is coming, if we take perio aside, we're just focusing right now on the pro fee side of things. You then add that up, and for the 2 visits per year, what your costs are, and that's how you're going to determine, and then typically go 15 to 20% off below that. Again, depending on your area, you may not be able to get away with charging $525 for the plan, but you might be able to do something like $399. So that's the place to start, okay? But if you, again, are setting yourselves apart and you're adding special membership pricing and discounts, and you're also offering them, you know, the whitening for life as a part of being a member or exclusively, or maybe you, your office knows the value of telling your patients they need an electric toothbrush. So that's included when they sign up, they get that gift. So you could really buy in the cost of these exclusive membership pricing, like Betty mentioned, Amazon has free shipping, okay, if you're a Prime member. So you can definitely set it up so that when we are ready to then sell it, you're selling more than the price, you're selling the value, okay? So when you're doing it, these are just some tools that you can use. The next thing you have to figure out for your office is who is going to then manage the membership side of it. So you can bill once a year that price at the time that they sign up. Some offices are asking questions of, well, how do we know who paid, when they paid? What if we do it monthly? We don't recommend, Betty and I, putting a patient on a monthly payment, okay? We are trying to create something exclusive, and any membership plan that you are on, you don't pay it monthly. You sign up ahead, you pay for it, and for 1 year you can use it. It's the same thing with this. We're trying to, again, ease the financial burden, and we're also trying to create patient loyalty, giving them a reason to say yes. And if we defer from that, you're going to end up getting patients. What if that month they can't afford to pay their $35, and now 2 months go past and you just lost that patient over a financial hiccup? So we don't recommend billing monthly, but you can, and there is ways that you can track that. And again, we have options that we can share with you as far as tracking from a separate source or within your practice management software. So managing, you know, the subscription and the renewals, I don't suggest it. So we really then have to talk about how we then are going to put it into our practice management software to be able to track when our members sign up, so that we can differentiate them from our patients who determined that they didn't want to do it that way. Okay. All right. Now that we've determined kind of these two factors and how we're going to kind of build the plan, the next thing that we're going to work on is how to track the membership. So there are ways that you can track outside of with spreadsheets. We've developed a spreadsheet for that if that's what practices want to do. If you decide to do it that way, you have to understand this is just another thing that the office staff has to figure out who's going to be the point person on it, who's going to track it, who's going to be in charge of adding the names to the one spreadsheet, where is it going to be kept, how does everybody know how to access it. Your practice management software will allow you the ability to create individualized plans within your system. So your system allows you, let's say a patient has insurance, they come into your office. You're going to do a breakdown of benefits, you're going to find out who their insurance is, and then you're going to have to, if you don't already have the insurance in your practice management software, you're going to have to build it. Well, instead of building a traditional insurance plan, you're going to build a membership plan within this area of your actual practice management software. You're going to name it. So whatever you've decided to name your plan, you know, that name is going to be the insurance area's name. So let's just say it's PLD savings plan. Your group number is then going to be whatever month your member signed up. So let's say, so you're going to have 12 of these plans, essentially, with the same name, but the group numbers are going to be different. There's going to be 12 of them that are completely separate, okay? So January group number, February group number, et cetera, et cetera. Once you've created these, you now have created something that can be tracked. There are different levels of practice management software and reporting. Some offer a utilization report that once you attach this to a patient's family file, you actually then get to print a report that shows who all is on this specific group of January who signed up. So this is how you're going to start to create your tracking, okay? We have now the financial tracking side of things. Okay, with the financial tracking side, you need to create a non-billable code, just like you have for Profi, just like you have for x-rays. So I suggest whenever you do our special codes that we use sometimes, maybe for our whitening for life, if you made one up, or use, instead of a D code, use an N code, like N as in Nancy, for non-billable. So you could have an N9999 code if you wanted. That code then has to have a fee attached. That's your membership fee. That's the fee in which you're charging your patient to be a member in your practice. The only thing that I recommend when it comes to multiple layers of membership plan is child versus adult. I don't suggest a family. I don't suggest perio versus, there's other ways that you can add perio services back in that they pay, you know, every other, you know, one. And again, going on to more information if you're wanting it, you know, we can send you information on how to follow up with that stuff as far as our membership in the box. But don't go beyond just the two, adult pricing versus child pricing. So you probably would create two codes, one for like an N999, maybe for an adult, maybe an N9996 for your child. And each one will have its own fee attached. Once you've now had the fee, you are going to have to decide at what percentage level you're going to want to adjust your regular cash fees at. We see anywhere between 15 and 25 to 30%. It depends on where your fee schedule is in accordance with your area. So So if you're in the 95th percentile, you have maybe a little bit more room to offer a little bit of a higher percentage discount off the top of your fees, but you're going to need to decide whether that's, 15 to 30%, again, depending on where you are, and you should be at least 20% above your lowest insurance contract rate. So say if Delta Dental is your lowest contracted rate that you see maybe on Crowns, then you want to make sure you're at least 20 to 25% higher than that fee, so that you're not giving an even deeper discount. Okay, you don't want to be lower than your lowest fee schedule in your office. So just make sure that you're in a good, happy place with that, and above your highest fee schedule. So when you're looking at this, you are going to have to do some comparisons. Once you go into your practice management software, you do need to then copy over the fee schedule to its own, name it, just like you do when you add in an insurance fee schedule. And then you are going to want to make sure that you then do a reduction across the board. So maybe that's 20%, okay? That's what you decided. To the nearest dollar. Make sure you round to the nearest dollar. You have these weird cents, and it's just weird, I think. But you're going to have to then go back to your services that are included in the membership pricing. So that's going to be your pro fees, your exams, your x-rays if that's included, fluoride if that's included, whatever all that is that's included has to then get put back to your regular cash fee. The reason that is so important is because when you are selling this membership, they have to see the discount that they're getting versus what they would pay if they didn't have the membership. The second important thing is we have hygienists and staff working really hard and doctors working really hard. We need to show that production. So the next code that you now need to create is an adjustment code. The adjustment code then would be named PLD Savings Plan Adjustment. That code then is used to adjust off those services that are included in the membership price. Okay, so you're still going to post your regular fees for those services to their account ledger, but you're going to then create a write-off so that you can also show the patient when they're checking out how much they saved by being on the plan. Okay, anything that you ever offer in a discount to a patient or write off should never go in as a zero. You should always show your patient what you're giving and what they're getting. That's value, okay? They need to see it, print it, share it, be proud of it. All right, the next slide. Okay, training. All right, when we are going through and setting up training for our staff, this isn't just, sitting there together and saying, okay, we have this membership plan and you guys have to tell everybody about it. And we charge this much for it and they have to pay up front. You have to actually share with the patient, with your team, how we're going to go about it. So as a team, you guys need to work together to create this membership plan. Your team needs to know your why and the reason why we're offering this, who we're offering it to, who's a candidate in your office. In order for this to take it off the ground, you have to educate your team for success, and that's where it starts, with knowledge, okay? The most valuable time spent is in a 2 to 3 hour training session where you go through the actual process, and there is we offer like an entire training portion workbook on this exact subject. Nothing is forgotten, nothing is left off the table. It really takes you through step by step by step of how to set it up as a team. Some other important things to remember when meeting with your team in the areas in which we need to cover as far as the plan itself is reviewing the benefits for the patients and discussing and setting it up your program. So again, how are we going to track? Did we determine we were going to make these 12 individual plans in our system? Are we instead going to use a separate tracker, and who's going to be the point person to ensure that it is the information is put into the Excel tracker if that's what you decided to use? I would suggest assigning what I call like a program director. That could be your office manager. It could be anybody. Somebody who oversees the health of the membership and shares with the team on a monthly basis during your meetings what the practice profits are and the success, and what is your community saying about it. Is there other ways that we can reach out? Where's our number one source of patients coming from? We're going to get into marketing next, and once we do, we then have to figure out something that's trackable, so that when you start to have these conversations, it's not just, yeah, I think all our patients love it, so they're just signing up. But how are they hearing about it? And where can we, if we're having success sharing it within our office, and that's where all our patients are signing up from, we have to talk about how to get it out into the community to get patients who need a dentist offering what you're going to offer, who become, again, loyal, driven to your practice because you are different than the guy down the street, okay? The last piece is scripting, okay? Scripting, Betty and I talk about scripting quite a bit. Scripting is not something that, scripting is just a way for you guys to have kind of, a guide to intro yourselves, but really it's going to have to come from each individual employee at the office and staff to determine how they want to approach and discuss and get it out there. So we offer some scripting that we're hoping we might have some time for today. We'll see where we end up, but if not, scripting is going to be something that's going to be really important so that the team is all comfortable explaining and getting a patient to see the value behind your membership plan in your office. All right, the next thing we're going to talk about is marketing. All right, so part of the training and setup is ensuring that how are we going to share with the community, our new patients and existing patients, what we are here to offer. With job losses that our country is facing currently, some are on furlough, some are not having jobs to come back to. Companies are not offering benefits to employees coming back. They're not going to be returning to a normal routine. And so offering something to your patients and as a team being able to communicate by asking for referrals, even with your, let's say even if you have patients who are in your practice and all day they're all insurance driven, they all have insurance plans, it doesn't mean that there are not opportunities to still talk with each and every one of them. It still is something that we can promote because they might have a family member who doesn't have health insurance any longer, doesn't have dental insurance, or maybe it's somebody that they work with that is, can't afford to get on the company's plan because the premiums are too high, whatever it might be. Don't be afraid to have these conversations with everybody. Don't exclude just insurance. Just non-insured. Make sure you're having it widely discussed. And what we do in my practice that I actually work in day to day, we actually in the morning huddle discuss who each of us are going to have a discussion with, so that it's a team effort, not an individual effort. We're constantly talking about new patients when they call in without insurance, and at my office we also talk about when patients ask, I don't have insurance, I need to come in. We have scripting down that we let them know that we offer our own in-house plan, that they don't have to have insurance to come see us. They are going to receive special member pricing. We offer XYZ. So we're all in mode to constantly be marketing ourselves to not just our existing patients with insurance but also anybody calling in to talk with us. Okay. We also need to make sure that you have a plan to add this information to your website. You need to make sure you have a plan to add this to your social media sites and campaign around that. Campaigning through your third-party sources, a couple times a year, letting patients know that, you have this plan in place. Again, going out to every patient, not just those that are insured, to everybody, because their situations could change. And businesses. A lot of small businesses don't offer healthcare to their employees. This is a perfect way for you to get your plan out to these small businesses and that they can, at a very, cheap rate, so to speak, offer this to their employees. They pay for it. Now you have new patients that are exclusively coming to you because they have a plan in place, okay? All right, the next step is implementation. So when setting up the membership, after we've gone through all of the steps, the training's in place, we now need to take our marketing plan and its strategies, and you have to have point people. Who's going to be in charge of all of the campaigning, the marketing, the website, ensuring that if something changes in our marketing plan or the way that we're getting ready to maybe do a Facebook campaign, let's say, the entire team has to be made aware of that, so that if a patient comes in and mentions it, you're not one team member is the only one who knows. So you're going to, each team member is going to have a position in this process that's important to making sure the whole team stays on the same page, okay, and we're all talking the same language. The number one source when reopening your doors and offering your membership is knowing how to reach your existing patients. So don't, again, be afraid to have the conversation with everybody. They're going to be your best advocates. They're going to tell the community about you. They are going to remember you if something devastating happens with them in a job loss. When they go to retire, they're going to have you in mind. If you have patients that have said to you openly, chairside or checking out, yeah, I'm looking at retiring in a year, I need to get all of the work done that I can so my insurance will cover it. So that's a perfect impromptu to say, don't worry, we have you covered, even if when you retire you don't have or keep your dental insurance. We have a great plan in place. We're here for you. Remember, we can talk about it. So there's so many ways that patients will tell you what their current situations are or needs or changes that are upcoming. We just have to have the tools in place to better have the conversation to educate them. It's no different than educating them on the crown or the broken filling or the leaking amalgam that needs to eventually be replaced. It's the same thing. We're just re-educating them on other valued benefits, like Betty said, we know that without proper care, with denying of x-rays because it's too much money this time. No, I don't want an exam, I just need my teeth cleaned. The two most important things that we do are x-rays and exams. That's how we treat, diagnose. If we're saying no and allowing the patient to say no to these important pieces to what we do, we're going to lose a lot of opportunity to care for our patients. So again, the team needs to be in place and able to have the right conversations. And then once all this is in place, you have a complete puzzle. So again, membership setup, training, discuss some marketing strategies, and then take it all and then implement. And then the next slide is a reference, because we don't know the laws of all your states. There's no way that we can. This is a website that will help you to actually find out what your state regulations are. It's very simple. It tells you what you can and can't do. And so this website is really important, and we can go ahead and share that with you. But by clicking on it, adding your state information, it tells you what you can and can't do with the discount plans in your state. All right. So I can see tons of questions popping up. So I'll take it back over to Betty, Rich, and them, and then we can make some decisions on what the next step here is.
Why don't we do some Q&A?
Mm-hmm.
Before we do Q&A, Sylvia, if you could just pop up that last slide that I gave you too. I think some of our participants might be interested in learning about that, because obviously Betty and Kara did their best to cram a ton of information in 45 minutes or 50 minutes, and we're going to stay on and do questions, and there's some fantastic questions. So we've got the time for you. We're here. We don't want to rush, and we want to answer your questions. But we also want to let you know, if you want to take it a full step further and really get some fantastic materials for developing a membership plan in your practice, maybe more information than you got here today on our webinar, we've got something called Membership Plan in a Box. It's something that we all developed together. And as you can see, it's just A to Z, manuals, video lessons, sample marketing things that you would send to your patients, a brochure, customized brochures for your practice, tons of information on the real nitty-gritty that we just unfortunately couldn't do in a 1-hour webinar, because we try to give you as much as we can, but there's only so much we can do in 1 hour. It's all in our Membership Plan in a Box, and you can learn more about it by going to matto.com/plan. The object of this webinar is to teach some really great stuff, not do it infomercial, but since we know that we can only cover so much, check this out. There's some fantastic stuff in there. We have practices all over the country using this. And again, the goal is you can learn and you can, that's the word I'm looking for, you can learn and you can put this into place. There's a better word for that, and it's escaping me right now, but you can learn, you can put this into place, and you don't have to pay some outside company every month. So don't do that. You can do it yourself. Go to matto.com/plan. So if you want to go to the next slide, we do have a webinar special, of course. Not only will we take $100 off the price of this incredible product, but we will do 250 custom brochures, not just generic brochures that we send, but custom brochures for your office included. No charge for the 250 brochures. So again, check it out at matto.com/plan. If you have any questions and want to talk to someone, we're at 800-258-0060. And let's get to some great questions. Again, Dave and I can ask some of the questions, but if it's something that you already talked about, the reason we're bringing it up is because people seem to keep asking it. So maybe they didn't quite get that, or they stepped out for a second. But I noticed a bunch of people were asking if it's always individualized, or if you also recommend doing a family plan. Anyone?
Or Betty?
Yeah, I didn't realize you were asking a question.
Sorry, me either. I'm like,
well, it was a statement.
Oh, cute.
okay. We're both like, what?
Sounds great. Yeah, so typically we have a single pricing for like a single person, right? This is how much it would be. And then if you have a spouse, then it's an additional fee with a savings attached to it. And then if they have children, then we would add the children onto that at a reduced fee, depending on what your office has set up. So for somebody like my mom with 10 children, obviously, if she was bringing in all 10 of her kids, we would offer her a savings for that. Someone asked earlier, how do you know the difference between child and adult pricing? So I kind of look at it, and I don't know if Kara feels the same way, but are you billing a child pro fee or an adult pro fee for the child? So depending on what their situation is with their mouth would depend on the pricing that you're going to offer them.
Mm-hmm.
Yeah.
Before we get to our next question, so I want to offer up a little, I don't know if I call it a gem, but I've noticed in a lot of the questions, and this goes for practically every webinar we do, people are saying things like, I heard that you can't do this. I heard you can't do that. And it kind of reminds me of the old days. Dave, remember our study club, the Maryland Bridge Club, which was the weirdest named study club. With a lot of great dentists in there, really good guys and gals. But, you know, someone would always come in and say, I heard we're not allowed to discuss what we charge for our crowns because that's collusion. I heard that if you do marketing, you can't say that your practice has been in business for 10 years. I heard this, I heard that. And usually the things that people were saying weren't true. Now, that doesn't mean that eventually somebody's not going to say something that is true. But because somebody at the study club or a dentist down the street or somebody told you, I can't do a membership plan in my state. I can't do this. I have to offer it to everybody in the country if I do. You know, all kinds of these crazy rumors we hear. I heard is not a reason not to do something. So, you know, reach out to us. We don't know everything, but we can certainly help you. If you're not sure, send an email. And if something we didn't cover here, send something to info@matto.com. We can get any questions to Betty or to Carol. But don't not do something because you heard. It's just most of the things that you hear are simply not true. And I see everybody shaking their heads because as dental educators, these are things that we, you know, have to listen to all the time.
I have an interesting one, and it was regarding a plan in Washington. So I'm in Washington State myself, and in our office, we do the voucher offer. So you are correct. So basically, we offer our membership pricing. It is paid, and then we have printed out on with the same form two additional vouchers that they are given, and then the patient in essence brings them to the office, and that's their voucher to get their teeth cleaned. So yes, you are right. It is a voucher program based in the state of Washington, but we still run it like any average. It's just they get an extra piece of paper with 2 creative vouchers that we created, and then we just ask the patient to bring it to their appointment and apply it.
You know, we one question it's not really a question related exactly to this, but we're getting a few people asking about doing printing. How do I print? How do I do a print screen? How do I take notes? Are you offering a replay? And I want to reiterate, we talked at the beginning. So in case you came in late, yeah, if you want to watch this entire video again, this entire webinar again, or even to go skip around of different parts of it that maybe you missed or you wanted to get some clarification on, go to our YouTube channel, which is the Dental Practice Fixers. We have this, it's going to be up, it's going to be available very soon after this is over. And when you do go there, again, make sure you check out the video, the webinar we did a couple weeks ago. What are the top dental practices are doing? It was a really good one. So check that out. And also on our Facebook page, which is the Matto Center for Dental Practice Success. So anybody that has missed anything, you're not sure about taking notes, you want to print screens out, all this kind of stuff, just go back and check it all. It's going to be available to watch at your leisure on YouTube and on Facebook.
Hey, we just put up the link that can tell you, people are asking about their individual states. So we just put up the link that has information on each state. So please check that out. Something that I saw in the question box, and maybe this wasn't, I don't know, but anyway, something that several people are asking is, what procedures do you include? Somebody said, do you include crowns and root canals? So let's really clarify the basics of how this works when it comes to preventive versus non-preventive procedures.
So what we suggest is if you're doing a lot of higher end cosmetic or and you use special labs for that, or
I'm going to time out for a second. I think it was more basic than that. I think maybe some people didn't get the concept of how this whole thing works, which is for the yearly fee, you get your preventive at no charge. Then you get all the other procedures, you know, and again, Kara was talking about some really exclusive atypical procedures. I'll say all the typical endos, crowns, partials, all that stuff at a discount. And maybe since now that we've established that, so you get your preventive at no charge with your membership fee.
Right.
All the other non-exclusive, exclusive procedures at a discount. And maybe Kara and Betty want to discuss what a typical discount is that a practice would offer.
Mm-hmm. Yeah, I usually see anywhere between 15 and 30%. Again, that's going to be dependent upon the levels that I always say is what's your lowest PPO contract fee for a crown, let's say, and then what's your highest PPO rate for a crown. And then we try to make sure that we are comparable with our highest and above at a 15 to 20% above that. So when you're creating your percentage across the board off of whether that's restorative, major, endo, prophy, whatever any of that is, you just want to make sure that you are in line so that you're not here to compete with an insurance company. And we don't want that. We want you to make good money. Some of the other questions that came up with, well, what do you do if your patients are fee for service and, you're going to gyp yourself? You're not. Success story with this particular membership plan, we had a practice that works with us on our consulting side, and we implemented it. And in the first month, they had 57 patients sign up, and they increased their case acceptance by 52%. It was a huge success for this practice and continues to be every single month. So don't get held up in and caught up in, well, I make an extra $300 off my crowns. When somebody has a membership, when they have something that they've bought, that they've invested in, their likelihood of saying yes increases. So you're losing out on them getting their teeth cleaned twice a year, getting those necessary x-rays for you to be able to diagnose. And now they have a discount on top of that to be able to get their work done. That's how society works. That's how we're driven. It's all about what can I get? So don't get hung up in my fee-for-service patients. Your fee-for-service patients are the ones who are saying, no, I don't want x-rays. No, I don't want an exam. No, I only need to come once a year. No, it doesn't hurt. I don't need to have that done. That's too expensive.
Kara, that's a really good point that you bring up, because a lot of times I'll see in offices where they feel that their patients maybe are in a situation financially where it's not really an issue. So they're paying full fee for everything. But then when we look at their treatment acceptance rate percentage versus what is being diagnosed, it's actually quite low for a lot of offices. So maybe some patients at that time are not saying no because they can't afford it. Maybe they say no and they have to think about it. But really, money does play a role. So even for your patients that can afford it, you're still enabling them to say yes to more treatment, to better care. So you end up making out in the long run, where it might seem like you're going to be taking a hit, but the overall majority of the patients that you're going to be able to help say yes to more care, you're going to end up coming out above in the long run with these types of plans.
And I think Sylvia may have put a sample. Was that a sample brochure that Sylvia put up there? You might want to put it back up there again, because that's Rich. That's the one that they'll get 250 of if they get our plan.
Yes, for similar, we customize. But Dave,
right.
I was going to also ask Sylvia, I don't know if you have this capability, but can you kind of blow up the middle section that says your benefits? I think that would answer a bunch of questions.
Oh, right.
I don't know if you're able to do that or not.
Hold on.
But then you can see in this particular office, and again, it's up to you, they charge $329 for an adult, $599 for a family plan. And then this is how they structure their benefits. I know this is a tough one to do. So you get 2 checkups a year, cleanings, all radiographs, fluoride treatments, consultations, oral cancer screening, emergencies, a 50% discount off your perio treatment, and then all other services, and again, except maybe some really exclusive ones the Kara started to mention, are 20% off the fee schedule. So it's a pretty basic, right here, example of how it works. You pay an annual fee, you get your preventive at no charge, and you get your preventive included, 20% off all your normal procedures, 50% off your perio procedures, your perio scalings, I should say, not surgeries.
And this was developed from our workbook. So again, this was all developed based off of the workbook that you and your team go through to come up with this as the end result. So you actually go through it as a team to develop all of these things and what you want to be included. It's very detailed with questions and how to set it up. I mean, this is just now the final end result for our marketing strategy. But all of this are tools to lead to something like this. And you can set it up any way you want. That's the beauty of it. You can set it up any way that you want.
Yeah, and I like that we're focusing on the benefits. We're focusing on the savings. Like some people will call it a discount plan or say discount. I'm a weirdo. I don't like that word because I don't want patients to think they're also getting discounted dental care and the quality. So focusing on the savings. And so someone asked, do you show them how much they're saving by being a part of your membership plan? Absolutely. Show them the difference of what it would cost if they were paying out of pocket for those preventive services, and then what they're saving with your plan. So really focusing on the benefits. That's where that value is created. Remember, when the benefits outweigh the cost. So when we focus on all that they're getting and it's helping them smile healthier, then they're going to see the value in accepting more dental care and then paying that yearly membership. That's really the biggest question. How are they going to pay that yearly membership? How are they going to work that into their budget? And what's interesting, I learned this a while ago, and I don't know where I learned it from, but
probably me.
Probably, because you're so wise. But for most patients, if they were out shopping, I can't remember the wording, but it was like, what are people willing to pay, like same day that they weren't planning on? Like, what is the max spur of the moment purchase, right? And it was around $250 to $300 is what people were willing to spend without knowing in advance. And the reason that they had that fee and that price is because most people had at least that on their credit card, on their max, and willing to spend it. So, but you have to think about, that's what people are thinking. How do I fit this into my budget? How can I make this work? And so if you can show them by paying this fee and how it's going to save them in the long run and be able to accept more care, they're going to be more willing to say yes. So it's how it's presented to the patient.
You know, along those lines, a really interesting comment from Dr. Bott, which is, do you share the fee schedule with your patients so they know that you're not jacking up the prices? And you know, at first I thought, well, I don't know, would anybody think that? But then I thought, every time I get the coupon from my car dealer, you know, 20% off oil change and this and that, I know that they jack up the price because they say you've got to present the coupon before you take your car in. So it's a scheme. And I would imagine that there are patients who maybe feel that way about this. Have you guys, Betty or Kara, ever delved into this? And what do you say to that?
I haven't. We use our practice management software to show what they would pay versus what they pay on the plan. So it kind of cost compares. So once they see that, I don't ever have anybody question, oh, did you jack it up 15% in order to get me at this discounted rate? And the only thing that we changed was what our cash fees for our preventative services that are included in the membership. And that's because our hygienists need to get credited for those procedures. And if we're building our model of fees against those services, you have to show them that today it's going to cost you, $550 for your visit versus $495 if you buy the plan, and you can come back in 6 months and receive another cleaning and exam and x-rays at no additional charge, and you're going to get 20% off, and you're going to get whitening for life, and. So it sells itself. It's like a no-brainer when you present it that way. I don't have anybody saying, no, that doesn't make any sense. Why would I not do that?
And it's important for people to realize that this is not insurance.
Right.
We don't call it insurance. No. They can't use it in addition to insurance. So if they already have a plan in place, they can't use this with it. Okay. And we wouldn't want to call it our in-house insurance plan, right? It's a membership plan, it's a savings plan, but we don't want to call it insurance because that's not what it is. Yeah. But if you think about it for yourself in terms of how many insurance companies work and what your patients are paying in premiums versus what their coverage is. But the best part about this is you don't have claim forms, you don't have waiting periods, you don't have frequency limitations, you don't have all of the restrictions that insurance companies place. Not even that, you might get an estimated coverage amount for a particular procedure, but what do we know? Once you send in that claim, they can pay whatever they want. There's no guarantee. This way, your patients really know exactly what is expected of them right up front. No guessing, no wondering what the insurance company may or may not pay.
Another point with that is, I also suggest for my offices to reach out to your specialists that you work with, the ones that you refer root canals to, your oral surgeons, and all of them, and let them know that you're offering this membership plan, and would they offer discounts exclusively to these patients if, once you called and helped schedule that appointment, would they offer an additional discount for your patients that are on this plan? And you'd be surprised. I don't think I've had anybody say no. They usually will honor it, and they're not even taking the membership plan fee. So that's another way for you to also add an additional layer of benefit to a patient that you have to refer out.
Good.
A few people have asked about care credit and the plan, how that works. If your patients want to utilize care credit, they also want to take advantage of the membership plan.
Tara.
Oh, that's my way of asking a question, guys. But
I'm sorry, I didn't actually hear you. I'm sorry, Rich.
It's okay. Maybe I'm muted. A few people have asked about care credit, and can patients utilize care credit and a membership plan?
So I'm assuming you're probably concerned about already giving a discount and then having to pay the care credit fee as well. Again, some offices set up where care credit can be used at a certain dollar amount, and or if they're you're going to have to make the decision for yourselves. We don't limit that to our patients. If that's their way of being able to get their comprehensive care taken care of, we offer it. And what you can't do, though, is include the membership price as part of how they pay for the plan. So you can't do. So you are going to have other ways for them to make payments, whether that's credit card, check, whatever that looks like for your office. But it would be considered prepaying, because if you are collecting the fee up front, which we recommend, then they are prepaying for future services under the exclusions of the plan. So you do have to have them pay separately. It can't be part of their the way they use Care Credit or Lending Club or whoever you decide to use. Care Credit is the main one that we suggest. So you can't use it that way.
Great.
Also, just one thing. Many of these other plans ask you to pay them a monthly fee. So just realize that what Rich talked about it a little while ago. If you do purchase the membership in a box from us, it's one time and one time only. You don't have to pay anything else at all, which is becomes kind of a no-brainer in my mind. No monthly fees.
Maybe you can put that slide up again so people can see what the membership plan in a box looks like, because it's really cool. Somebody asked if they need an attorney. What's your feeling on that, guys?
If you're unclear with by clicking on the link and looking at what your state allows, if it feels unclear to you, I mean, it can't hurt for you to, cover yourself and talk with an attorney. That would be something you'd have to decide on your own.
But it's got to be the right attorney. I think you can't just you can't just find like a trampoline attorney or something.
Yeah.
I mean, it's got to be somebody that knows this kind of law, right? I mean, seriously, I mean,
Right.
would a general attorney really understand this?
It can't be that.
When I went through each of the
Oh.
websites, that really it's not as restrictive. The site's going to be very informational for everybody. It's pretty black and white the way they have it. They have it in a table. It's pretty easy.
I know we've got a bunch of Canadian viewers on here. Somebody just asked if we have Canadian clients. I don't know if they meant Canadian people using our membership plan in a box. or just Canadian clients in
Coaching
general for our
clients, or coaching clients, right.
Betty, you had some really good information too. You reached out to a source because this has come up before when we've talked about membership plans.
This has come up quite often, is can I offer this in Canada to my patients? And we know that in Canada, a lot of their guidelines and rules are very different than here in the States. And so I did ask someone, and they pretty much, it was, you have to proceed with caution, and you're extremely limited and to be able to offer any type of savings plans to your patients, and it's going to be different based on whichever province the office is under. So it was basically, don't do it. But if there's ways that you can legally get around it, you probably need to consult right within where you're at. And Canada's tricky, and my husband's Canadian, so I know that. But yeah, I did ask him that question.
He tricked you into marrying him.
25 years he's got me. No, but it has nothing to do with it. But I just know that the healthcare, everything looks very different than it does here in the States. And so the same with their guidelines as far as what you're allowed to do with marketing and savings plans over there is very different than here. So you have to be very careful.
Hey.
Betty, if you got in your car and started driving towards the Canadian border, how long would it be before you got to Canada?
Right now from my house?
Yeah.
5 minutes?
25 minutes.
Okay, so hey, Betty and Kara work with clients from all over North America, so we'd love to work with some Canadian practices.
Mm-hmm. Sure. Absolutely. Okay.
Well, hey guys, this has been just fantastic. Once again, as you see, Dave and I love working with our fantastic dentists and team members from all over North America, but when the time is right, we leave it to our incredible coaches. And you just met two of them today. They are so knowledgeable and so patient and so kind to present these webinars and to work with our clients. So thanks so much, Betty and Kara.
I think everybody that's still on the webinar, which is a lot of docs and team members, need to give Betty and Kara a tremendous round of applause. It's just fantastic job, guys.
To themselves too, to you guys.
To everybody here.
There.
It was really good. Really
I feel
nice.
like a trained seal. And even after the webinar, we're here for you. As Dave said, go to our YouTube channel, Dental Practice Fixers, to watch replays of this and any other webinars we've done this year. But also, Madow.com is our website, MADOW.com. And if you have any questions for anyone, even a question about marketing, Whitney, our marketing expert, wasn't on today's webinar, but she's here for people with marketing questions as well. Just send it to info@Madow.com, and Sylvia will make sure it gets to the right person, maybe even one of the co-founders. But we're here for you. We really are.
Yeah, we're all here for you. And you know, it's been a tough time. And if you find yourself still at home and not really sure what to do, and you have a question or you're stressed or struggling, seriously, Betty or Kara would jump on the phone with you for a quick little call and to discuss something that's going on. If maybe you don't want to ask here, in public or whatever it might be, we're happy to really help you out in any way we can.
Perfect. Thank you
Thanks
all.
so much, everyone.
Thanks so much, everyone. I think, Rich, we've got something, I believe something really good coming up also in a couple of weeks. Is that right? Is it about 2 weeks or so?
I'd say it's 99% on the docket. 2 weeks from today, another one in our What the Top Practices Are Doing series with one of the absolute top dentists in the country. So write it on your calendar. You do not want to miss it.
See you all soon. Thanks everybody for joining us.
Bye.
Bye.